trial is recommended, what questions should a patient ask about the trial itself?
Yeah, I mean, I think when it comes to that, I think that the important things to ask really are, what are the drugs involved? And, what your doc thinks about those drugs. I think, what is the alternative? So, again, we were talking about option A, B, and C. Is this option A of A, B, and C or option C of A, B, and C? Are there ones like Cindy mentioned where, if you don't do it at this point, you're going to lose the opportunity because you started on something else? Because a lot of trials require either that a person has never gone through therapy, and so they want, this is sort of a first line trial, but some trials are, you have to be at the second thing that you've been on, so these are the things that matter to know. Are you going to lose an opportunity if you didn't do it now, or can you do it later? And what is the preference? And I think, practically speaking, a patient really wants to know, what is the schedule? Can I handle this? How far away do I live from the place that is giving this trial? What are the locations available? Because, if there's a trial and you have to come in every 2 weeks or come in 4 times in 2 weeks and then once every month after that, that makes a big difference depending on where you live, what season it is, weather, that kind of stuff. And I think the question that you don't really have to ask, but a lot of people ask, is about cost. Medical care nowadays is complex. It costs money when you don't expect it to. It doesn't cost money when it's, you just don't know what will and what won't. Financial toxicity is something that we really care about, or every center is really trying its best, but it's hard to do in this type of environment. So people then get concerned that clinical trials might be even more complex. I think clinical trials are much less complex in that way, because a lot more of it is covered by the sponsor, whatever that sponsor is, whether that sponsor is the National Institutes of Health as a grant or a pharmaceutical company. But in general, a clinical trial really should cost the same or less than whatever the standard medical care is. That's the way they're built. So many people ask us that question, but I think that is the question that probably is less important than what are the drugs? What does your doc think about this? Are you going to lose an opportunity if there's a different sequence? And does this fit into your life and your schedule, and people who can give you rides?
Yeah, right. Are there resources available to assist with the financial impact of a clinical trial?
There are not specific resources for clinical trials. There are specific resources for patients in general, though. Every medical center has a way to. There are things as like helping with utility bills sometimes with rides. I think a lot of clinical trials do pay for things like parking in general. So that the trial itself has, many trials themselves have extra financial support in them. There are even, there was a trial I remember that paid for airfare and lodging, because there were only 5 centers in the country. And so we had people fly in and the whole thing was covered. It depends on the trial. But in terms of outside of trials, there are always patient advocacy groups and things like that, that where certain things can get covered, but often the types of things that get covered by those groups are the same things that get covered with normal medical care.